Respiratory therapists, also known as respiratory care practitioners, evaluate, treat, and care for patients with breathing or other cardiopulmonary disorders. They treat all types of patients ranging from premature infants whose lungs are not fully developed to elderly people whose lungs are diseased. They provide temporary relief to patients with chronic asthma or emphysema and give emergency care to patients who are victims of a heart attack, stroke, drowning, or shock. They interview patients, perform limited physical examinations, and conduct diagnostic tests. Respiratory therapists test a patient's breathing capacity and determine the concentration of oxygen and other gases in a patient's blood. To evaluate a patient's lung capacity, respiratory therapists have the patient breathe into an instrument that measures the volume and flow of oxygen during inhalation and exhalation. Therapists who work in home care teaches patients and their families to use ventilators and other life support systems. Respiratory therapists should be sensitive to a patient's physical and psychological needs. They must pay attention to detail, follow instructions, and work as part of a team. In addition, operating advanced equipment requires proficiency with computers. Respiratory therapists generally work between 35 and 40 hours a week. Because hospitals operate around the clock, therapists can work days, nights, or even weekends. They spend long periods standing and walking between patients' rooms. Respiratory therapists advance in clinical practice by moving from general care to the care of critically ill patients who have significant problems in other organ systems, such as the heart or kidneys. Respiratory therapists, especially those with a bachelor's or master's degree, may also advance to supervisory or managerial positions in a respiratory therapy department. Respiratory therapists in home health care and equipment rental firms may become branch managers. Supervisory positions and intensive care specialties usually require the RRT certification. Some respiratory therapists advance by moving into teaching positions. Job opportunities are expected to be very good, especially for those with bachelor's degree and certification, and those with cardiopulmonary care skills or experience working with infants. The vast majority of job openings will continue to be in hospitals. However, a growing number of openings are expected to be outside of hospitals, especially in home health care services and offices of physicians or other health practitioners. An associate's degree is the minimum education requirement, but a bachelor's or master's degree may be important for advancement. A license is required to practice as a respiratory therapist in all states except in Alaska and Hawaii. Also, most employers require respiratory therapists to maintain a CPR certification. Licensure is usually based on meeting the requirements for certification from the National Board of Respiratory Care. A certified respiratory therapist can take advanced classes and pass 2 separate exams to become a registered respiratory therapist. About 81% of jobs are in hospitals, mainly in departments of respiratory care, anesthesiology, or pulmonary medicine. Most of the remaining jobs were in offices of physicians or other health practitioners. The median annual wages for a respiratory therapist are around $52,000. The middle 50% earn between $44,000 and $60,000 a year. The lowest 10% earned less than $37,000, and the highest 10% earned more than $69,000. This interview is with Julie Abbas, who is a respiratory therapist at Rosemont Hospital. What is the title of your occupation?
Well, like you said, I'm a respiratory care practitioner.
What aspects of your occupation most appeal to you?
Helping other people and being needed at a critical point.
What do you do in a typical day?
Well, the first thing I do is I check what the plan is for the patient. And I check the data on the computer, I talk with the nurses, and also the physician in charge. This will give me a way on how to approach on treating the patient. I check their physical assessment, and the main priority is their homeostasis needs. I check their heart rate, their blood pressure, and listen to their breathing with my stethoscope. From there, I can figure out if they need medication or if they need clearing of airways.
What are the physical and psychological demands?
You need to be able to stand on your feet all day and be able to correlate on how the patient is doing to what the ventilators are giving the patient.
What type of organizations employ people in this field?
You can work at the hospitals, neonatal, rehab, and as an educator.
What are the entry-level requirements in this occupation? Like what skills do you need?
You need to know patient assessments, work machines, and of course, customer service.
What about education or any special training?
You need an associate's in science, but now they require both the CRT and the RRT. You also need a CPR card and volunteer work.
What about experience?
Clinical work that you learn from different hospitals that the school puts you in.
What pay range or benefits can you expect?
Well, the starting is between $27 an hour to $30 an hour. Benefits differ depending on which hospital you are employed at.
What areas of the country offer the best employment outlook in your occupation?
Northern California and Texas, pretty much anywhere except for San Diego.
What, if anything, did you give up in order to pursue your occupation, and was it worth it?
I had to give up full-time occupation and of course my social life, but it's definitely worth it.
What are some of the things that you dislike about your occupation?
Nothing. I love what I do.
Well, Julie, thank you for letting us interview you, and we wish you continued success in your occupation.